Do you know if you are COVID-free? Get tested and find out. You can help to stop the spread of the coronavirus. Testing is free, and there are plenty of testing appointments available at our convenient COVID-19 testing locations around the island. Book online at www.gov.pm/coronavirus-get-tested or call the COVID-19 hotline at 444-2498 between 9 a.m. and 9 p.m. Everyone in Bermuda can help us stay COVID safe.
Council drug formulary regulations, which is the delivery of a campaign promise, and also further updates from her ministry. Following the minister, I will discuss the extension of the public health emergency, the cannabis legislation, which was passed in the House of Assembly, the upcoming 2021 budget. Unfortunately, the Chief Medical Officer is not with us this evening, although he may be joining a little bit later. But first, we'll hear from the Minister of Health. Minister?
Good evening, everyone. There were 240 test results received by the Ministry of Health since the last update, and none were positive for COVID-19. There are no recoveries to report at this time. Bermuda has 703 total confirmed positive cases, and their status is as follows. There are 10 active cases, of which 9 are under public health monitoring, 1 is in hospital, and none are in critical care. A total of 681 have recovered, and the total deceased remains at 12. The mean age of all confirmed positive cases is 43 years, with the median being 40 years, and the age range from less than 1 year to greater than 100 years. The mean age of all currently active cases is 43, with the median age being 41 years, and the age ranges from less than 20 years, with that age group representing 10 to 29 years, to greater than 70 years, and that age group 70 to 79 years. To protect privacy and confidentiality, age information will not be provided on the hospitalized case. The mean age of all deceased cases is 75 years, with the median age 77 years, and the age range from less than 60 years, with that age group representing 50 to 59 years, to greater than 80 years, and that age group is 80 to 100 years. The source of all cases is as follows. 209 are imported, 493 are classified as local transmission, of which 402 are local transmission with a known contact or source, and 91 are local transmission with an unknown contact or source, and 1 is currently under investigation. As investigations proceed, transmission categories may change. Of the more than 170,000 test results reported, the mean age of all persons tested is 43 years, with the median age of 42, and the age ranges from less than 1 year to greater than 100 years. Additionally, during the week of the 14th to the 20th of February, 681 saliva screening tests were conducted. Therefore, as of the 20th of February 2021, results have been received from 5,809 saliva screenings. The mean age of all persons screened is 58 years, with the median age being 59, and the age ranges from less than 10 years to greater than 100 years. The 7-day average of our real-time reproduction number is less than 1, and Bermuda's current country status remains at sporadic cases. I must emphasize that public health measures put in place over the Christmas and New Year period, and since then, were critical to controlling the most recent outbreak that we saw at the end of last year. Having all residents and visitors adhere to these measures was what enabled our country status to change from cluster of cases to sporadic cases. We have provided the necessary information to the Center for Disease Control to aid in the reassessment of our designation health level, risk level. Currently, we are classified at level 4 COVID-19, which is risk is a very high. However, our metrics put us at level 1 COVID-19 risk, which is low. So we are negotiating and engaged with the CDC to have that rating readjusted to better reflect the reality in Bermuda. For those who are traveling, I must remind you again that if you need outbound COVID-19 tests, you must book yourself in for outbound travel testing via one of our community sites at Pennell's Wharf, Bull's Head, or Star of India, and you must do this at least 2 days before the date that you plan to leave Bermuda. This meets the 72-hour rule imposed by the United States, the United Kingdom, and Canada, and gives the MDL lab time to process your results. Do not get the test the day before travel, or worse, on the day of travel, as this leaves no room for unexpected delays. You can book through gov.bm/coronavirus get tested. There will be no walk-ins. Also starting next week, all of the community testing sites will have the same operational hours, and that is from 10 a.m. to 4 o'clock p.m. I will now provide an update on the vaccine program, which plays a key role in Bermuda's return to normal. We have completed the 6th full week of vaccinations and the 4th week using 2 vaccination centers operating 6 days a week. For the 6-day period from the 11th of January to the 20th of February 2021, Bermuda has administered a total of 16,377 vaccinations, and that figure will rise to 17,073 if you include yesterday's vaccinations as well, all of which is a very impressive achievement. Of the 16,377 vaccinations administered for the period, we are reporting on which ends February 20th, which is the epidemiological week. 9,028, or 55% of those persons, are female, and 7,349, or 45% of those individuals, were male. Bermuda's goal of herd immunity will be achieved when 70% of our population, which is 64,054, has been immunized. To date, 18% of the population has been vaccinated with 1 dose, and 7% of the population has been immunized with 2 doses. Each week since January 11th has seen an increase in the number of vaccines administered, with 3,804 vaccinations delivered last week. The public has accessed these vaccinations as follows. The vaccination center at the Bermuda College, which was previously at the Police Recreational Club, administered 9,373, or 57% of the vaccinations, and 6,119, or 37, were administered at the Bermuda Hospitals Board Vaccination Center. 744, or 5%, were administered at rest homes and long-term care facilities, and 141, or 1%, were administered at other vaccination centers. Assessed against Bermuda's vaccination priority targets is as follows. In Phase 1A, 1,605 persons, or 51% of those aged 80 and older, have been vaccinated, and 638 have had 1 vaccination, and 967, or 31%, are fully immunized. 373 persons, or 50% of residents in rest homes and long-term care facilities, have also been vaccinated, and 72 have had 1 vaccination, and 301, or 41%, are fully immunized. 1,303 healthcare workers, or 53%, have been vaccinated. 347 have had 1 vaccination, and 956, or 39%, are fully immunized. 1,316 essential workers, or 56%, have been vaccinated, with 596 having 1 vaccination, and 720, or 30%, are fully immunized. With respect to Phase 1B, 4,193 persons, or 44% of those aged 65 to 79 years, have been vaccinated. 2,533 have had 1 vaccination, and 1,660, or 17%, are fully immunized. These are great results so far, and I would like to thank all of those who have taken the step to get their vaccination to protect themselves, their families, and our community. I would also like to remind residents that we are now in Phase 2 of Bermuda's COVID-19 vaccine allocation strategy. Phase 2 is residents who are 50 years or older, have been diagnosed with heart disease, chronic kidney disease, liver disease, diabetes, or have a disability, are of no fixed abode, or essential travelers, persons who must travel for medical purposes or to return to school. If you fit the criteria for Phase 2, you should register for an appointment by completing the registration online at forms.gov.bm/COVID. If you were eligible for the vaccine in Phase 1A and 1B and have not yet registered, please do so. Do so today. If you are not able to access the registration form online, ask a friend, a neighbor, or a family member to register you online, or you can call 444-2498 and select option 2. The Ministry of Health's appointment processes will ensure that you keep your priority status. I know that callers have been having difficulty getting through, and please know that the system upgrades are now completed and additional staff are being put in place to answer your calls. This is important, so if you don't succeed the first time, please try again. The volume of calls is high, and we have expanded the hours of operation to accommodate this. The vaccine hotline is open from 8:30 a.m. until 5 o'clock p.m. Monday to Friday, and 9 a.m. until 1:30 p.m. on Saturdays. With regard to the numbers of persons who have registered their interest, to the week ending February 20th, 19,389 persons have registered their interest in getting vaccinated, and the breakdown is as follows. 4,445 are black, 9,208 are white, 2,124 are mixed or other, and 3,612 prefer not to say or not specified. For those of you who have registered already, thank you, and please encourage your family and your friends who may be in those priority groups that we just spoke about to also please register. The Ministry of Health is starting to see the positive results and a true measure of the effectiveness of vaccines in data being reported from around the world. Countries like Bermuda that have implemented aggressive vaccination programs are now seeing decreases, and in some countries dramatic decreases in the number of persons infected with the coronavirus and those numbers of persons that are requiring hospitalization. This is the type of beneficial outcome we are anticipating for Bermuda, and as we continue to vaccinate more and more people. This does not mean that we can stop the other public health measures that we have in place, so please continue to wear your mask, practice physical distancing, employ good, proper hand hygiene, and download the We Health Bermuda app. Even if you are immunized, please do all of those things. I'm also pleased to announce a partnership with the Ministry of Health and Age Concerned Bermuda to provide assistance to their members to receive the COVID-19 vaccination. Starting Monday, March 1st, adults age 50 and over who require assistance with transportation to their scheduled vaccine appointments can call Age Concern on 238-7525 to arrange free transportation. In order to receive this free service, individuals must have already registered and received their vaccination appointments. The transportation is being provided by Project Action and will include travel to and drop off after your vaccination appointment, and is good for travel to vaccinations at both the hospital as well as the vaccination center at the Bermuda College. These types of partnerships are vital as we must all work together to ensure that everyone who wants to be vaccinated has the opportunity to do so. Across the world, experts agree that transitioning beyond this pandemic depends on the prevalence of immunity, especially among older and our more vulnerable members of our population. The single most important thing that we can do as individuals to achieve the population-wide immunity that slows down the virus's spread is to get vaccinated. And if we don't, we risk additional outbreaks that will come at a terrible cost, and this is not something that none of us wish to experience. As announced last week, there will be changes to the traveler's 14 days for immunized persons starting next week. We recognize these changes will most immediately impact persons seeking to dine indoors, go to the gym, play contact sports, and the like. They will also impact other public health guidance, such as the return to work and return to school policies. Until the amendments to public health guidance have been thoroughly reviewed and agreed by Cabinet, which will be next week, nothing has changed. If you are immunized now, you must continue to adhere to all public health guidance, which was in place before you were immunized and which continues to be in place now. On Friday last week, I tabled amendments to the Bermuda Health Councils Act 2002 to bring about important and overdue changes to the high cost of medications faced by many Bermudians. The Progressive Labor Party promised Bermuda in our 2020 platform that we would establish a national drug formulary that will set maximum pricing for common essential medications, which will reduce the cost to consumers. The purpose of the Bermuda Health Council Amendment Act 2021 that was tabled is to support the function of the council in regulating the price at which drugs are sold to the public by establishing in law the Bermuda Health Council Drug Formulary Regulations 2021. The objective is not to control the price of every medication sold in Bermuda, but rather the Bermuda Drug Formulary will comprise a list of common essential medications such as metformin, which is used for type 2 diabetes, or prednisone, which is used in the treatment of arthritis, blood disorders, cancer, and eye problems, along with other associated products and devices used in medical treatments which are intended to be medically appropriate, cost-effective, and sold at a regulated price. The pandemic has highlighted the struggle to those in our community who are uninsured or underinsured, and establishing a drug formulary to at least place price control on common essential medications will help. Before I close, in my remarks last week, there was some conflicting information about the numbers vaccinated in the over 80-year-old group. We reported that 1,834 were vaccinated with a coverage of 59%. That number in today's report is 1,605 vaccinated, which represents 51% of coverages, and that is correct. So the last week's number was 47%, and I apologize for that reporting error. As always, please continue to follow the public health measures and guidelines put in place for our collective safety. Continue to wear your mask and practice physical distancing, and get vaccinated when it is your turn. Thank you.
Thank you, Minister of Health, and certainly thank you and your team for your tireless work on the front lines of this pandemic. Through your efforts and the efforts of doctors, nurses, public health staff, and volunteers at our vaccination center, we are getting closer to our goal of having 19,000 persons fully immunized by March 31st. With 17,073 doses administered through yesterday, Bermuda remains among the top 10 countries, according to Our World in Data, in the world for vaccinations administered relative to population size. What is most important is that the number of doses administered increased this week by 24% over the prior period, which demonstrates that the move to the Bermuda College has had its intended effect of increasing the pace of our vaccination program. While this is very welcome news, it is vital for all Bermudians to understand that until we reach that goal, until we make sure that a significant amount of our seniors and the vulnerable are immunized, it is not a time to let our guard down. We've certainly worked hard as a country to get ourselves to a place where curfew can be removed and measures can be relaxed. But it is important that we do not undo that hard work by neglecting our collective responsibility and ensure that we adhere to the measures that are still in place. As we know, it only takes one person to start an outbreak, and it is vital that we remain vigilant. Please ensure that you continue to follow the regulations, specifically the regulations governing the amount of persons that can gather. In addition to that, the regulations which are necessary and required for mask wearing, physical distancing, to ensure that you are doing what is necessary to reduce the potential spread of the virus. Failure to adhere to these measures endangers the community and the progress that we have made. And I want to be clear that the government will not hesitate to reimpose measures such as curfew if it is deemed necessary in the interest of public health. Now, I know that there is some commentary in the public domain that the government has been heavy-handed in its approach. Let me address those criticisms this way. I would prefer to be criticized for being heavy-handed than to be criticized for having excess death and endless lockdowns, which we've seen in other countries. Bermuda has not had a shelter in place, which ended at the beginning of last May. We have not had to shut down non-essential businesses with the exception of bars and nightclubs since the period in the outbreak. Whereas we've seen in many different countries, whether that be in the United States, whether that be in the United Kingdom, whether that be Europe, whether it be the Caribbean, whether it be in other places where we have seen a significant amount of restrictions which have happened and have continued. Our heavy-handed actions preserved economic activity and allowed the opportunity for limited tourism in this country for people to earn a living. That is a record that I'm proud of, and for persons who would criticize the government for being heavy-handed, unfortunately I must disappoint you, because we have choices to make, and this government is going to make sure that we choose the side of ensuring that we keep the country safe while striking the balance to allow economic activity to continue. Last Friday, February 19th, during the first session of the House Assembly in 2021, the Minister of Health, the Honorable Kim Wilson, recommended a 60-day extension to the public health emergency order. This was passed by the House on Friday, and yesterday it was approved by the Senate. The public health emergency, therefore, has been extended until April 25th, 2021, and at that time we'll assess whether further extensions may be needed. Also, during the House of Assembly session, the Attorney General and Minister of Legal Affairs and Constitutional Reform, the Honorable Kathy Simmons, led the debate on the Cannabis Licensing Act, a bill which was tabled in the House last year for information purposes, amend, and finally tabled in December, which was debated yesterday. This act ushers in a new regulatory regime licensing all activities involved from cultivation, import, export, production, research, sale, supply, use, or transportation of cannabis or medicinal cannabis in Bermuda. This bill was brought to the House of Assembly after an extensive consultation process with experts in health, law enforcement, and finance. The government also consulted the public through the development of the Cannabis Licensing Act to ensure that it reflected the desires of the Bermudian people. The feedback that the government received was there was a desire for change in our cannabis laws, which would permit licensing and regulations for cannabis activities to displace the illicit market. Regulation and licensing will ensure that Bermuda benefits economically from the cannabis industry, while it will also ensure that it provides easy and simple access to medicinal cannabis, which is right now very difficult due to our complex regulations. What is important is that the government is committed to ensuring that licensing is accessible to those Bermudians who have been negatively impacted by cannabis prohibition, the majority of whom are Black Bermudians. The government anticipates that they will take the opportunity to use their expertise to open businesses, conduct research, and contribute to this newly regulated sector of our economy. I thank the Attorney General and her team for their outstanding work in preparing this bill, and I look forward to the bill's progress to the Senate next week. I also thank the members of Parliament of the Progressive Labour Party who were encouraged to speak and to vote their conscience rather than in line with the party. In keeping with the developments in the House of Assembly regarding our economy, the Minister of Labor, the Honorable Jason Hayward, introduced last week Friday the government's Economic Investment and Residential Certificate policy. There has been much said about this policy in the public domain, and some of the comments around the fact that it is nothing different than what previous governments have proposed, which may have been opposed by the party of which I represent. While it is correct that the Economic Investment Certificate is not entirely new, as it is something that has been introduced, and it is in combination with the residential certificate, this policy contains significant changes from previous requirements that were put in place in 2015 in regards to residential certificates, which solely benefited wealthy persons who wished to live in Bermuda. And this is important to note. Previously, wealthy persons who wished to live in Bermuda or to reside, having access to a residential certificate, because in order to have access to a residential certificate, you had to prove that you had enough means to not have to work in Bermuda, which meant that you were independently wealthy or globally retired. Individuals would only have to pay a $525 fee per year for a residential certificate, and were not required to make any investments in Bermuda. This new policy, so this could have meant that a wealthy person could have either purchased a property which wasn't of the size, or be leasing a property and getting a residential certificate, and if they were worth lots of money. They did not have to bring any of that money to Bermuda, so they'd have the ability to live in Bermuda, but they would not have to make any investments in Bermuda. This new policy will require wealthy persons who are now able to reside in Bermuda prior to the economic investment certificate, which is key to note. But this new policy will require wealthy persons who wish to reside in Bermuda to make an economic contribution to the country. These changes ensure that more Bermudians can benefit from wealthy persons who choose to reside here by ensuring they contribute to the economy's well-being. In sticking with matters on the economy, this coming Friday, February 26th, the Minister of Finance, the Honorable Curtis Dickinson, will present the 2021-2022 budget to the House of Assembly and the people of Bermuda. It will be, no doubt, a budget greatly affected by the coronavirus pandemic and the substantial economic impact that it has had on our country. However, the budget statement will outline the government's focus on rebuilding and commitment to diversifying our economy while ensuring that funding and resources are made available to keep the promises so that the government can deliver on the 2020 election platform and the government's 2020 throne speech. So I hope that you will tune into the budget statement this Friday. It will certainly be aired live on CITV. And you can certainly watch it on all of the media channels. I'm sure that they will be carrying the feed. And I look forward to the presentation from the Minister of Finance as we had just finished Cabinet getting our briefing on the budget and noting that we will make sure that we are funding the critical initiatives which are necessary while preparing for an economic recovery, which we know that will happen as long as we continue to work together. As I wrap up, we know that many in our community may need extra emotional support. If you need someone to talk with, please call the Emotional Wellbeing Hotline. The phone number is 543-1111, and that line is operated Monday to Saturday from 5 p.m. to 9 p.m. Once again, that number is 543-1111, and I'd like to thank the volunteers who continue to allow that line to be maintained. It is incredible the service of which you're doing to this country, and I want to thank you for continuing to serve. To get accurate, reliable, and timely information from the Government of Bermuda, sign up for the government's WhatsApp service by adding the phone number 504-6045 to your contacts and send us a simple message saying hi, and you will receive WhatsApp updates from the government. Additionally, to get information, download the Tree Frog app in the Apple Store or Google Play, and go in the search bar and type Tree Frog Bermuda and download the free app today, which will make sure that you stay up to date with all news and information from the government of Bermuda. In closing, before I go to questions from members of the media, I would like to remind everyone to please continue to observe the coronavirus regulations which are put in place. They are put in place for a reason. Someone was saying, joking with me, about the fact that we had such low case numbers, and yesterday I said our case numbers are up more than 50% from last week. These things can change quickly. The coronavirus has not left us. We will continue with our testing program, with our vaccination program, but the one group of people that can make sure that we beat this virus and make sure that we can continue on the path of return to economic growth is all the people of Bermuda working together and observing the restrictions. So I hope that you will continue to do that. Now, I'm happy to take any questions that members of the media may have.
Premier, we'll start with Bermuda Broadcasting.
Good evening, Don Burgess from Bermuda Broadcasting. The scientific data coming out of countries like Israel and the UK regarding the vaccine is overwhelmingly positive. The vaccines are working very well, particularly in elderly and vulnerable populations. How can we do more to encourage Bermudians to register to be vaccinated?
Well, I've said this actually before, and you can help with, as members of the media can assist us with respect to the importance of vaccination and getting that messaging out. It's one thing for us to continue every Tuesday to come out here and reiterate that, but the media can also play a part. You can assist by ensuring all of us can assist by ensuring that those persons that particularly should be in phase 1 or phase B are most vulnerable, medically vulnerable, or persons of more maturity should register, because we need to ensure that we take steps to try to get as much protection as we can for those particular individuals. As I've mentioned previously, there are individuals that because of their own other medical challenges are not able to get immunized. So they're counting on us to help to establish herd immunity by getting immunized. If we look at measles, for example, that was eradicated through vaccination. The last case of measles in Bermuda was in the 90s. And fortunately, vaccinations helped to address that issue. So likewise, we want to make sure that as many people adhere to the messaging. And if you have any doubts or any questions, please rely on mainstream resources. The government website has quite a lot of information on it concerning vaccinations. The Bermuda Health Council, likewise. There's a lot of information out there, and we're advising people to rely on that as opposed to Facebook and Twitter tweets. Excuse me. But it's really critically important that all of us do our part by getting that messaging out and recognize that we can only best get herd immunity if we get more people to be vaccinated.
Thank you. Last week, there was a government statistic that said something like only 48% of medical staff in Bermuda had received the vaccine. Is this acceptable, and shouldn't the number be closer to 100%?
I think the statistic today was increased. I don't have it right in front of me, but it has increased. But remember, vaccinations is not a mandatory, it's not prescriptive. So we're just trying to encourage members to get vaccinated, and that would include, of course, persons that work within the medical field. Everybody, we're encouraging them to get vaccinated again so that we can reach herd immunity. But, of course, it's not mandatory.
Okay. Vaccine passports seem inevitable and are already being developed in many countries and will be required for travelers shortly in certain places. Is government preparing a vaccine passport, an official vaccine certificate, or a digital certificate so that islanders can show proof of their vaccination when overseas?
You going ahead of that? Yes, we are in the process of putting that together. I actually have documents in front of me that I haven't been able to read, but we have been working on that. I know that from the initial basis, there's an international document that could be used for persons to be done. The difficulty certainly in using it overseas is the fact that you want to make sure that you have some type of commonly acknowledged document that will be able to be recognized. There are certain standards that are being used. There's a Common Pass standard, there's an IATA standard for air travel, and so we are working with trying to make sure that we get the best standard for interoperability. So that is early days yet. So there's a question of what we'll be doing locally and what we'll be doing for international travel. But at the very first instance, the Ministry of Health will issue old school form items so those can be done.
Yeah. So you'll receive a letter. There's a letter that will be supplied to the individual that indicates the lot number, the details of the vaccination. But ultimately, as the Premier indicated, we'd like to have some type of digital passport that persons can use for travel.
Okay, thank you. If herd immunity is reached at 70%, or in some estimates 80% of the total population, how can Bermuda achieve herd immunity when under 16s are not able to be vaccinated? Israel has recently begun COVID vaccine trials on children aged 11 to 16. Is this something the government would consider?
Trials. Let me answer both of your questions. The first one with respect to the herd immunity in the under 16-year-olds, that question obviously was asked last week to the CMO, and as he indicated, 70% of our population would help us to reach herd immunity. However, we are focusing our efforts on those persons that are the most vulnerable, the over 65-year-olds and the persons that have medical vulnerabilities. Having said that, when we move into phase 2 and phase 3 is for everyone to be able to register to be vaccinated, then we would certainly be encouraging all persons over the age of 16 to become vaccinated so that we could ultimately reach herd immunity. With respect to Bermuda doing similar tests that they're doing in Israel, I don't think we have the infrastructure to actually be conducting testing on individuals that are under 16. You would note that the emergency authorization that Pfizer received was for persons over 16 because they hadn't done enough sufficient trials. The fact that Israel is doing that has a far more sophisticated number of population for them to be able to do that it's not, I don't think, something that would be expected for a population of 64,000 to do trials on 16-year-olds and below, when that might be, what, 2,000 of them?
There will be no vaccine trials taking place in Bermuda, Don.
Yeah, thank you. What's the likelihood of Bermuda reaching herd immunity at 70% when that would require 90% of the adults to be vaccinated?
I'm sorry, what is the...
What's the likelihood of us reaching 70%
Of herd immunity?
Herd immunity?
We are that is our
so-
desire.
so
I appreciate it doesn't include
the
the
rest
16.
of the part of it was like it would require 90% of the adults for us to reach 70% because children make up, those under 16 make up a significant number of the population.
Right. I'm not sure children under 16 make up a significant amount of the population. I don't have the data in front of me. So of the 65,000 that's in our, based on our last census, I don't know what percent of those represent 16-year-olds and below. Recognizing we have a aging population and a decreasing birth rate, I suspect that the majority of those persons are obviously on the higher ends of the spectrum, which is why our focus is, in addition to those persons that are medically vulnerable, also ensuring that we make sure that those persons that are in phase 1 or 2 that are over 65 register for the vaccination. Sorry, phase 1A and 1B for over 65-year-olds. We have to just continue the messaging, and I would employ members of the media to assist in that regard. And there was something I read the other day. It might have been the Royal Gazette. I can't remember. Something recently concerning the importance of vaccination, and I applaud that effort because we need to ensure as best as possible that we take that we continue that messaging for persons to get vaccinated so that we can get herd immunity. So I would rather spend my efforts on encouraging that message as opposed to what if we don't.
Okay, thank you. My last question. Last week we heard reports of only 5 out of the 10 vaccine stations at the Bermuda College being in operation. Do we still have a staffing issue?
We are still working through some of the staffing challenges. In fact, tomorrow, I think Friday we had, what's today? Today's Tuesday? No, I think Friday we had 10 in operation. Tomorrow we have a full slate. We have 550 scheduled appointments at the Bermuda College, 250 at the BHB, so all 10 sites will be operating at the Bermuda College tomorrow.
Great, thank you very much.
Don, just want to make sure that I repeat. Vaccine doses up this week by 24% over vaccine doses administered last week. We're certainly making progress.
Premier, Royal Gazette.
Good afternoon, everyone. Owen Johnson Barnes with the Royal Gazette. First of all, we have heard, obviously, about the alternate strains of COVID-19 spreading overseas, and we have been some discussion about whether we're testing for it here. Can you give us any update? Has there been any evidence of the South African strain or the South American strain spreading?
The CMO indicated that we have been doing the sequencing, sending samples over to the United Kingdom for them to assess them on our behalf. And to date, they have not identified any of those variants being located in Bermuda. We are expecting very, very soon to be able to do the gene sequencing here in Bermuda through the MDL lab under the directorship of Dr. Karika Weldon.
I can give you an update on that as well, because I did just get a message that popped in. The reagents that the minister is speaking about have arrived on island, and so by next week's press conference, Dr. Weldon says that they will have all 358 positives that are inside of the deep freeze at MDL tested before next week's press conference. So there'll be news to report then.
Hey, breaking news.
All 358 positive samples that are there will be tested.
All right. The next one is a bit more of a financial one. We had recent communications with a member of the Tour Boat Association who's expressing concern about the lack of support they have received since COVID-19 started. You know, they see the bars are getting some degree of support. They see the taxi drivers are getting some degree of support, and they've been out of the water for most of the last year. Obviously, the 8 p.m. curfew is still in effect for boats, and if you're limited to only a handful of people on your boat, it's going to be a hard time breaking even. Can you say what measures are going to be put in place or being considered to give them the boost they need this coming year?
Here's what I'll ask. I don't know if there is a tour boats association. or something along those lines. What I will say is that I'm happy to make the resource, the Bermuda Economic Development Corporation, available. If the individual who is writing to you would like to write to premier@gov.bm. I know I've seen some communication regarding tour boats. One of the requests was for the boat curfew to be pushed back to take into account for sunset cruises. So that was the reason why the boat curfew was pushed back from 6 to 8. But we just have to be honest and realistic. We know that there are persons who will use the water to violate curfew regulations, and we're trying to make sure that reduce the occurrence and possibility of that. These are things that will be re-examined next week, and there may be some changes to that. There may not be changes, but for the individuals who are concerned, I'd encourage them to email premier@gov.bm. If there is a tour boat association or some group of persons, I will facilitate a meeting with the Bermuda Economic Development Corporation to see what type of assistance we may be able to provide.
Now, earlier on, you mentioned the recently passed in the House of Assembly cannabis regulations. You mentioned the consultation that took place. Can you say what consultation was carried out between government and government house? Have you had any discussions with the premier, with the governor?
Not talking to myself recently.
Hopefully not. Have you had any conversations with the current governor or the previous governor about ways that you can make sure that this legislation gets royal assent?
So here's my view and take on this, and I am quite honestly surprised by the commentary that will find itself in the local media by persons who seemingly have a warped sense of what democracy means. And so for persons, whether they be MP Dunkley, for persons otherwise, here's the facts. The government laid out its position on this bill. The government went through a lengthy and extensive consultation process. The government took external legal advice with experts in regards to international treaties and regulations. The government is not going to put forward something that they do not believe can conform and comply with that. And if our regulations were modeled after what is in place in Canada, another realm of the Commonwealth of where the Queen serves as the head of state, and those are acceptable there, I cannot possibly imagine why they would not be acceptable here. The fact is that there are many points in times when the relationship that exists between the cabinet and the governor may not be on the same page. The view of the government of Bermuda is that democracy shall prevail. And the thought that an elected member of the House of Assembly, certainly someone who may have served in this high office, would say that the democratic will should bow to unelected representatives either here or 3,000 miles away is it's just shocking to me. But it shows the mentality of what some people will have. My view is very simple. We execute things based upon what is outlined in our platform. And there is one thing that is clear. The government to which I lead takes measures which are put inside of platforms seriously and advances them. And the only time those matters are changed is through consultation. That is what we have done in this instance. We believe that we are on firm legal footing, as the Attorney General laid out very clearly in her presentation to the House of Assembly, that territories where conventions are extended to can only do that with their consent. It is that simple. We do not live in a time of the 1960s and 1950s with unabashed colonialism, which exists. We live in a time, a point, and place where we can be free to make our own laws, and Bermuda has a long tradition of internal self-governance, and that tradition, I expect in this case, will be upheld and reflected.
Just to confirm, because you didn't actually say it, was there a consultation with Government House, the current governor or previous governor, on this legislation?
I will tell you what the Constitution of the country says. Any paper that goes to cabinet is shared with the governor at the time of it coming to cabinet. And every week, just as the Prime Minister of the United Kingdom meets with the Queen every week, the Premier of Bermuda meets with the governor. I will never, ever disclose the conversations in public nature that I held in my weekly audiences.
Now, former Progressive Labour Party leader Mark Bean recently said in an interview with us that, similar to what Michael Dunkley said, that the legislation is drafted in such a means as to antagonize the UK and to worsen the relationship between Bermuda and the UK. How do you respond to that?
Well, that's surprising coming from Mark Dean, but nothing much surprises me nowadays. Here's what I would say. I will say that the legislation was written so that we could pass legislation that would confirm with our international obligations. And so when we look at another Commonwealth realm, Canada, when our things are modeled after what is being done there, something that is acceptable, I don't know. But I guess politics makes strange bedfellows. So I know that Michael Dunkley and Mark Bean were at war in court once, but now they're at war against me. So be it. We are going to press on with what we laid out in our election manifesto. We are going to press on with what we've laid out that we said that we were going to do. And in this job, one of the things that I've learned is that there will be political sniping all the time. It's very easy to speak from the sidelines. It is very difficult to lead. We are going to press on and lead on a number of initiatives we will. So for those persons who want to claim ulterior motives, I think it's rather rich. We put down legislation. We said we were going to move forward. We sought international legal advice so we can understand the sound footing in which we're on. Nothing was worded in any shape or form. And to say that, it's almost to say that Canada wanted to get to a fight with the United Kingdom. It's ridiculous. People will play politics, and I'm not going to, get in that back and forth. We have many things that we said we're going to deliver to this country, and we're working on doing them inside of a very imperfect constitutional construct.
Final question. You mentioned in the House of Assembly that you feared that the relationship would be destroyed if the cannabis legislation did not get approval. Now, given that Bermuda is right now only receiving our vaccinations from the UK, obviously that might change in the future, is there a risk that by damaging that relationship now, we might end up hurting our flow of vaccines into the country?
Unfortunately, I didn't have the opportunity to read the article in your newspaper this morning, but someone was sending around a WhatsApp group, and I saw some excerpts. I would call it shocking paternalism, which was displayed by the person who once held this office, by saying that we do not have the ability to criticize the United Kingdom because they are giving us vaccines, is a mindset from a different era. And it's just shocking to me. I just cannot wrap my head around that. I delivered a tribute on Saturday at a funeral. And I said that we will honor Laverne Furbert's legacy by speaking truth to power. I'm not going to be bought or silenced in any way, shape, or form with trinkets. I am appreciative of the relationship in which we have, but I'm also appreciative of the fact that in a democratic society with full internal self-government, that the democratic will of the locally elected representative assembly should be upheld and observed. And nothing is going to stop me from expressing that opinion, because that is what I believe, and that is what my oath is to the people of whom I serve.
Thank you very much.
No problem.
Premier, we have Trevor Lindsay on the phone. Trevor, go ahead.
Good evening, Trevor Lindsay calling from via cell phone. Good evening. Let me start. First of all, Premier, a message to you from Mrs. Grace Woodley, Mama Grace Woodley up at Seal, that is sending her warm regards. That she listens every Tuesday, and she's saying hello. That's my first statement.
Good evening to you, Mrs. Woodley.
Minister of Health, can you clarify for those watching, because there seems to be some confusion amongst the community, for those traveling after having being vaccinated with both jabs when they return to the island?
Yes, Trevor, there is something on our website called the Traveler's Continuum, the Traveler's First 14 Days, and that indicates what persons can and cannot do upon arrival to Bermuda. It includes the testing protocols, but it also includes no outside dining until day 4, test results, et cetera, et cetera. Individuals that have received full immunization, which is 2 vaccinations, and 2 weeks following the second vaccination, will be eligible for not having to adhere to that traveler's first 14 days, the traveler's continuum. They will still, upon arrival, have to have their pre-test, arrival test, et cetera, but the traveler's 14-day continuum, where persons were wearing the different colored bands, red, gold, and green, et cetera, depending on what stage of the traveling continuum they were at, does not apply to persons that are fully immunized.
Your next question?
Good stuff. Another question, Minister of Health. Any updates on the moonlighting or the nurses that work at 2 facilities? Is this ban going to be lifted at any time soon?
We are reviewing that, but just to clarify it, Trevor, it's not a ban. It is individual nursing homes, depending on their level of compliance with respect to public health guidance, the ability to access PPE, et cetera, et cetera. Each nursing home is assessed individually, and if certain nursing homes meet a particular criteria as established by the regulators, then they can have persons work within their home that work at other homes. So it's not with the person, it's actually with the home. So if a home has met the requisite criteria, then their staff members are eligible to work at multiple homes, depending on, of course, the principal place of employment's requirements, because there are certain establishments that will not allow them to work at multiple homes. But those are questions that we are reviewing as well, Trevor, because our status obviously is changing, but you would appreciate that those rules were put into place principally to guard our most vulnerable, which is, of course, our seniors that are in institutions and rest homes.
Next question.
Another question coming from healthcare workers that seem to be challenged. They're getting different conflicting different reactions from bus drivers if they have their uniform on. Some are allowing on and some are not allowing on. What is the protocol on this situation?
I can't help. Sorry.
You might want to answer. I think you might. I'm not sure if you need to ask that to the Transport Ministry. I'm not quite following. I know that there are requirements for persons that work, I believe, in under BHB, that they are not to go out in public with their uniforms. They're meant to cover up. But insofar as individuals that might work at, it's so hard nowadays because people wear those scrubs. You might work at a dentist's office, or you could work as a nursery and have on those type of clothes. It's very hard to control, but I do understand that BHB has a requirement that individuals that work are meant to change before they go out in public after their shift.
Next question.
Okay, another question for you, Minister. Do you have any data from those that may have been positive of COVID-19 during the 3 international events last November, i.e. the golfing, the sailing, or the rugby tournament? Do you have any data that you can release on those that could have been positive that could have helped to spike the head in November?
No, the spike that we had in November related to a series of events that occurred on the weekend of the 27th of November. They were not golf, and they were not the other 2 events that you spoke about. They were a funeral and a club.
Premier, this question is for you. Then again, this question is for the Minister of Health. Premier, I'm glad you spoke of the cannabis bill, and you did invite your colleagues to speak on this bill. But it was noticeable that the Deputy Premier, the Health Minister, National Security Minister, and Minister Vance further did not speak on this in their opportunity to speak. Do you, Minister, support this cannabis bill?
Trevor, as you rightly said, the bill was fully, extensively debated for several hours on Friday by the House of Assembly, and it passed through the House of Assembly.
The other thing in which should be clear, Trevor, is that from the perspective, there's one of 2 things. Government legislation, of course, always enjoys the support of all ministers. That's what cabinet and collective responsibility is. But the second matter is there are 30 members, 29 PLP members in the House Assembly, and if all 29 PLP members spoke on every single bill, we would have the definition of a new mode of filibuster. So not everyone speaks on every single bill, Trevor. That's just the nature of the way that things work. I don't speak on many. Others don't speak on many bills, etc. So I know that for some persons there's a view that everyone should speak on certain things, but people will just always cause mischief. Government bills are supported by cabinet ministers, and cabinet ministers that cannot support government bills must resign from cabinet. That's just the nature of the way that this system of government works, and it's always been the nature. This is a government bill. Backbenchers were free to vote and speak their conscience, and backbenchers were free to vote and speak their conscience.
Your last question?
My last question, yes. I don't know if the Premier can answer this. Why are inmates at our 2 facilities being told that if they seek work release, they must get the vaccine. Several inmates have been vaccinated to date. Is this policy at our prisons?
That's the first I've heard of that. If you can put that in writing to DCI, I'm certain that they will follow up with the Minister of National Security, but I can't speak to that at all.
Premier, there are no more questions.
All right, I'm happy that we're able to provide the update on the latest statistics. We'll be back again next week. We're switching to a time that's a little bit earlier as a request of members of the media. So next week, we will aim to start at 5:30 p.m. Next week, of course, will be updates following a 2-week review of restrictions in addition to other matters. So I want to thank everyone for their attention this evening and sign off by saying thank you and good night, Bermuda.